Welcome to today's presentation, Cannabis Laws and Policies, Federal and Regional Update, and Using SPF and Prevention Science to Inform Policy. It is my pleasure to introduce our presenter today. Scott Gagnon is a Certified Prevention Specialist, Director of AdCare Educational Institute of Maine, Incorporated, and Director of the New England Prevention Technology Transfer Center. Scott chairs the National PTTC Network's Marijuana Risk Work Group, appointed by the Maine Speaker of the House. Scott serves as the Public Health Representative on Maine's Marijuana Advisory Commission. In addition, he chairs the Maine affiliate of Smart Approaches to Marijuana, and has also served as co-chair of the Prevention Task Force for the Maine Opiate Collaborative. Scott recently served on the SAMHSA, Center for Substance Abuse Prevention National Advisory Council. Scott trains and presents in New England and nationally on marijuana science and policy, as well as on prevention workforce development. Scott's work has been recognized with awards for multiple organizations, including the Maine Alliance to Prevent Substance Abuse, Healthy Androscoggin, and the Maine Public Health Organizations. In 2017, Scott was the recipient of the Patrick J. Kennedy Outstanding Advocate Award from Smart Approaches to Marijuana. I will now turn the time over to Scott. Welcome.
All right. Thank you for having me. I'm glad to join you all this afternoon here in Maine for this webinar. Talk about, there's my opening slide. Talk a little bit about what we're going to talk about today. So I understand this is the second in your series, and today we're going to focus on policy and prevention. And so kind of what we're going to look at is first kind of looking at the stages of state marijuana legalization laws and the multiple layers of marijuana policy. As I'm sure you're aware, there's a lot of changes happening in many states across the country, and we know that your states are facing or may be facing proposals for law changes or policy changes there. So hope to provide you some examples of what's happened in other states and what it could potentially look like in yours. Going to talk about the importance of prevention, taking sort of the leading role in identifying some of the potential public health issues that could emerge from the commercialization and legalization of marijuana, whether it's for medical purposes or adult use. And then talk a little bit about the intersection of policy and prevention, because that's really important. Certainly we've been doing marijuana prevention for a while. It's not new, but what is changing are the laws and the policies, and we have to think about how some of those proposed changes in laws and rules can affect how we do our work. So you kind of heard already about my background. So I kind of bring a mix of education and training in public policy, but also working in the field of prevention for over 15 years. Really, since 2013, I've been fairly immersed in the world of marijuana policy, politics, and prevention. So I kind of bring that kind of mixture to the table here. Just a little bit of housekeeping on my end in terms of terminology. So when we talk about legalization, one term I don't use is recreational marijuana. I know that's one that's commonly used. So you'll hear me refer to it as adult use marijuana when I talk to what many refer to as recreational marijuana. Part of that is just in my personal opinion. I believe that recreational is can be a bit of a normalizing term. So I think it's, again, this is just kind of my view to use the term adult use instead of recreational. And if I'm talking about medical marijuana, I'll say medical marijuana. So this is kind of a snapshot of what marijuana policy looks like across the nation. Of course, this is ever changing. Many states have initiatives either in their legislature or potentially going to a vote to citizens. So the light green states are states that have some form of legal adult use marijuana. The dark green states have some form of medical marijuana, and then the gray states are not quite there yet, or maybe there's something that's in process. So before we were doing this webinar, I did a little bit of research to see get the snapshot of what marijuana policy looks like in your region. Of course, Colorado was one of the first states that legalized adult use marijuana, along with Washington. And then some of other states in your region do have some form of medical marijuana. And you can see there's some variety in terms of the possession limits, whether it's an ounce or 2 ounces. There's some differences in terms of how many plants an individual can grow at home for medical marijuana. Quite a bit of variety, but most of your states so far looks like don't yet have any form of adult use marijuana. And as we'll see, and we'll start talking about next, is there does seem to be a fairly predictable timeline that these changes go through. So let's talk about that, sort of the marijuana state legalization life cycle. Because while the details may look different from state to state, really the pathway is very similar. So every state that has some form of adult use marijuana, they've kind of gone through this cycle, you will, of changes. So often it will start with some kind of new law or initiative around decriminalization. For some states, such as my state of Maine, that actually happened back in the 1970s, where we had a law passed that decriminalized possession of a certain amount of marijuana. From there, you will tend to see the next phase is to move into an initiative to legalize possession and sale of marijuana for medical purposes. From there, you will often then see the next phase, which is looking at statewide legalization or adult use. Sometimes there can be some steps in between that happen. There can be what I call local legalization. So this is often a city or municipality will have some kind of local ordinance or vote to allow within the city or municipal limits the possession of a small amount of marijuana. And I put legalization in quotation marks because more often than not, these are kind of symbolic votes, such as we had one in Portland, Maine, where they passed an initiative to allow the possession of up to 1 ounce of marijuana. The reality, though, is state law and, of course, federal law trumps local law. So it does tend to be more of a symbolic vote than actually having any significant policy change, although it certainly could have an effect on enforcement. The other thing you tend to see in between, before you even pass or look at passing adult use marijuana, you'll often see changes already happening to the medical marijuana laws that were passed. And frankly, that's a phase that doesn't really ever change. And I actually have some examples to show you from here in my state in Maine. And then after statewide legalization of adult use marijuana, that you'll almost immediately see proposals to start changing some of the rules and regulations that were passed by the legislature or by citizens. So again, the details may look a little different, and the amount of time it takes for these to transition from one to another may look different from state to state, but pretty much any state you look at that has adult use marijuana more or less has followed this trajectory. So because I'm from Maine, and I'm just going to use Maine as an example to show you kind of real time what this looked like. So as I mentioned, in the 1970s is when we had our law passed to decriminalize possession of 2.5 ounces of marijuana. So there was basically as equivalent of a speeding ticket, depending on how much you possessed, there was a certain fine associated with that. 1999, we passed legalization of medical marijuana possession. So that allowed the possession of up to 2.5 ounces of marijuana for medical purposes. 10 years later, we passed the initiative that actually opened up the dispensaries to sell the product for medical marijuana. From there, we went into our adult use marijuana legalization phase. So in 2013 is when we saw the city of Portland have a vote to legalize possession within the city limits. To that, the next year, we had 2 more cities in Maine look at that, South Portland and Lewiston. It passed in South Portland, but didn't pass in Lewiston. And then 2016, we had the statewide vote. It was a citizens' initiative to pass adult use marijuana. So there are really 3 stages of legalizations. I show you sort of the finer details of the steps, whether we're talking about decriminalization, medical marijuana, or adult use. But within any one of these policy proposals or initiatives, you tend to see 3 phases. The first phase, or the first stage, is the campaign. So for example, if you're in a state that's considering passing initiative around medical marijuana legalization. The first part of that is the campaign phase. So that's the organization or the advocacy group that is trying to pass this initiative. They'll start a campaign, and there can be lots of different elements to that, which we'll talk about in a minute. Shortly after the campaigns phase, of course, there's going to be the vote, whether it's in a legislature or whether it's a citizens initiative. There'll be some kind of vote, and then if it passes, it will go into an implementation phase where the legislature sort of has to set the direction for what the rules and regulations will be. And then the third stage is the post-implementation changes phase. So that's where it's passed. The legislature has sort of set the direction for what, how it's going to be regulated in your state. But then almost immediately in legislatures, you'll often see proposals to change what was already passed. And again, I'm going to show you some examples of that in a bit. And so, as I mentioned, this really applies to whether you're talking about medical marijuana legalization or adult use legalization. And often it's really the same advocacy groups that are involved in both initiatives. So talk a little bit more detail about some of these stages. So the first one is that campaign stage. And the timeline for this can look different. In Maine, honestly, the campaign stage really started in 2013 when the city of Portland was having their vote, because Maine, we only have 3 media markets. So something's happening in Portland, the whole state is hearing about it. So that really was where the beginning of the statewide campaign phase started. So there are a couple of national advocacy groups that tend to be involved in these, and if not, sort of spearheading the initiatives. They are the Marijuana Policy Project and the Drug Policy Alliance. So they often tend to be involved, whether it's providing resources for the campaigns or actually running campaigns. They tend to be involved in a lot of these. And what you'll see in the campaign stage is a lot of different methods for getting messages out. It'll be traditional media, whether it's TV, radio, print, social media. In the campaigns, there's a lot of utilization of social media, really any kind of platform you can think of. Public events, whether it's a panel of speakers, or it could be a public event at the legislature with like-minded lawmakers. Debates or other kind of stunt kind of public events. Op-eds and letters to the editor, and then several other methods as well. And the other thing, and if you've probably seen this in your state around those of you that have medical marijuana that's passed, you've probably seen this, is that these campaigns tend to get a lot of coverage really in all forms of media. Local media in particular really like covering the story. It does tend to generate a lot of clicks on news websites and get a lot of readership. It's it's kind of controversial, but hot topic that a lot of people like to follow. So you do see a lot of coverage in the media. The trick with that, of course, is that there seems to be some narratives that appear more in the public conversation than others. When we think of sort of the arguments for legalization, again, whether we're talking about medical or adult use, there's 3 main narratives you tend to see. One certainly is around revenues, particularly with adult use, the talk about how commercial marijuana will generate tax revenues for the state. As a job creator, that dispensaries and cultivation sites and all these different operations will create a lot of jobs. And then the social justice and criminal justice argument as well, about how it addresses those issues. So these are the 3 narratives you tend to see a lot of in the coverage of campaigns. The ones that either go missing or are understated are the ones that we really focus on, of course, which are the issues of addiction, the impact on health, the impact on communities and kids, social costs, impairments, all those risk factors that we know about in prevention. Now, these are things that local media in particular, they're not really geared or to think about necessarily. So this is really, where we have, those of us in prevention and public health have our work cut out for us to try to get those messages out, to make sure the public has sort of a balanced perspective on what these policy changes could mean. And so this is really, where our role comes in to help tell the full story of what might happen. So, there is a lot that can be at stake with this, and but for some reason, and kind of in my observation, and in speaking around around the country, and talking to different folks, is that sometimes there can be some reluctance in our field to really engage in this conversation. And I'm not talking about lobbying. I mean, that's a whole different conversation. But just to talk about the effects of commercial marijuana and what we know about marijuana science and the effects on youth and communities, there can still be some reluctance in the midst of these campaigns to even just kind of do what we're supposed to do. And there's a few reasons for that. One is it certainly is a controversial topic. There can be a lot of strong opinions on this, whether it's from our leaders and our lawmakers or from sectors that we work with, or folks in our community. There can be really strong opinions on this, which can make it maybe a little intimidating to get engaged in. The other argument I sometimes hear is that, well, we'll get our seat at the table after this passes, and then we'll have a chance to influence it. And while that could happen here and there, my experience, again, talking with colleagues and friends in other states, is that doesn't seem to always happen by default. More often than not, those of us in public health and the prevention fields really have to kind of fight our way to the table to be heard. And sometimes even then it can be challenging. And then the other thing I often hear too is, well, we'll need to wait kind of for the dust to settle and see what the final laws and rules are going to be. And then we can kind of figure out how we're going to address that. But as I'll mention, that doesn't really ever stop. Even if adult use or medical marijuana does pass, it's not going to stay in that, whatever rules or regulations are written, it's not going to stay that way forever. As I'll show you almost immediately, there'll be changes proposed. So there really won't be any dust settling. It's always going to be changing. And so there's really not going to be any stoppage for us to kind of find our way in. But the other way to think about it, and this relates to the campaign stage, is like if our voice isn't heard, the voice of public health expertise and prevention expertise is not heard, it will be filled. Education will happen, but it will happen in ways that are perhaps not evidence-based. And I probably this example from Maine, which was the drug duel, which was part of the 2016 campaign. This gentleman was the head of the legalization campaign in Maine, and he proposed this drug duel, which was he challenged the police chief from South Portland, Maine, to meet him at the community park. The idea was that he was going to consume marijuana, the police chief would consume alcohol to see who drops, who blacks out first. The point, the kind of stunt, and the point of this stunt was that narrative you may have heard around, marijuana being safer than alcohol. That, of course, is not, that messaging isn't evidence-based. It's not based on science. It's a talking point that's been kind of focus grouped, and it may, in a political sense, have some buy-in, but it's not certainly evidence-based. So I just provide this as an example, as there is a vacuum. There can be this vacuum of information, evidence-based information on marijuana and the public health effects. So it's really incumbent upon us to find our way to make sure that is filled with evidence-based information, not stunts like this. So the next stage, if it passes, so if you have a medical marijuana legalization initiative or an adult use legalization initiative that passes, the next part is going to be implementation. So basically what that means is it's whatever is passed, whether it's through the legislature or through a citizens initiative, it's going to next go to the legislature to basically set the direction for the making of the rules and the regulations. So there are those two phases. One way to think about it is the implementation legislation is sort of the outline of what legalization will look like. It's not the finer details. It's sort of these are the things that we're going to address when we write the rules and regulations. But it is really the outline. It's not the finer details. It's that next stage of writing the rules and regulations, which is the finer details of what each section will look like. So for example, one example is in the implementation legislation, they may set some direction around advertising, and they may say things like, there's going to be limitations on where advertising can happen. There's limitations on packaging, so it doesn't appeal to young people. But that's kind of like general direction. It's the rules and the regulations that provide the specific sort of guidelines and parameters of what that looks like. So that's one way to think about it is implementation, legislation is the outline, but rulemaking is really sort of that finer, detailed report. So one thing to bear in mind with this is typically in both stages, there will be hearings involved. Here in Maine, when our implementation legislation was rolled out, there was a hearing for our lawmakers, but also for the public to participate in. Same thing with rules and regulations. When the part of state government that's going to be responsible for regulating medical marijuana or adult use marijuana, when they write their rules, they're going to release them to the public, and then there will be an opportunity for the public to weigh in at those hearings. So that's just an important thing for us to understand in our roles, is that there will be these opportunities where you'll get to hear what's being proposed, and then there's an opportunity for feedback on what's being proposed. And this is really a prime opportunity for the voice of public health and prevention to be heard. I mean, certainly, again, I'm not talking about lobbying, I'm just talking about, providing education in about some of the potential risks. And education can have an impact. So while earlier I talked about how, by default, the Welcome Mat isn't necessarily rolled out for public health to have a seat at the table, through some good advocacy and public education, there can be changes that you can see from some aspects of implementation that may have looked risky. So I was just providing some examples here from here in Maine. So when our adult use marijuana legalization bill or citizens initiative was passed, there was a provision in there that would have allowed for social clubs, which basically are on-premise locations for people to consume marijuana. But from sort of the public health community, there was a lot of concern around the potential impact on impaired driving. Mostly because in Maine, we have very strong indoor smoking laws, which pertains to vaping devices. So what that meant is really the only forms of marijuana that would be able to be consumed in these locations were edibles. There really wouldn't be anything else you'd be able to consume. And through education on the delayed effect of edibles and how that could affect impaired driving, lawmakers pulled back on that. And then there's some other examples here around labeling and packaging and potential appeal to youth. And then also in our implementation legislation, there was a proposal to not completely prohibit under 21 to licensed locations. They were just going to set up some restricted access areas. But again, through some education, lawmakers saw that really the best thing to do is just to not allow them to enter any portion of any of these locations. So a couple more points about legalization laws and policies. So there's what's written in proposals and laws, and then there's what's not written, and that's where we get into the issue of loopholes. And just a couple of examples, again, from my state, although this has happened in a lot of states, where a lot of states that have legalized adult use marijuana, they'll have this gifting provision where an adult 21 or over can gift marijuana to another adult 21 or over in their state. The loophole that's arisen in many states is that the regulations don't really spell out that you can't get compensated for other aspects of that gifting process. So what you saw in Maine and Massachusetts and other states is that, letter of the law, people were giving the marijuana away for free, but they were charging a fee for packaging or for delivery, or there was some other product that was being gifted along with the marijuana that you were charging for, like really expensive t-shirts. So that was not expressly prohibited in the implementation law. So folks were kind of picked up on that, were able to take advantage of that loophole. Many states, including my state of Maine, quickly realized this was an issue and did eventually write some or amend in through legislation rules to kind of close up those loopholes. But that's just an example of how what's not written in the law sometimes can cause some issues. The other thing we saw in Maine was this particular loophole, which, so what I'm showing you now is page 27 of the 35-page initiative that our voters voted on. And there's this little line of text which is innocuous if you don't know what it is. And I'm highlighting it here. And the problem is this line of text, what this did is this is how possession of marijuana of up to 2.5 ounces was legalized in Maine. Basically what they did is they deleted the civil violation for possession of marijuana of up to 2.5 ounces. But the problem is that our juvenile code in Maine points to that code, that adult code. So when you delete that, the juvenile code is not pointing at anything for when it comes to youth possession of marijuana. So what that means is it was, with that removed, it wasn't unlawful for youth to possess marijuana. So fortunately, the legislature picked up on this and quickly, after they came back in the session, closed that up. But again, it's just an example of how sometimes these things can be hiding in plain sight. One other thing I wanted to share when it comes to rules and regulations, and this is again is kind of a watch out or a thing to look at, is sometimes something can look really good on paper in terms of public health, but when it actually comes to implementation, it might not be that effective. So I actually have an example on this slide, and I don't know if you can see it, but if you look under the colored bars of this slide, you can see some really tiny text. And if you can't read it, what it says is, can you read this? This is the minimum font for health warning labels for marijuana products in Maine. So when you look at our rules and regulations, it says, that all marijuana products in Maine are going to be required to have a health warning, which sounds great on paper. So the warning is going to apply to marijuana and pregnancy and addiction. That looks really good on paper, but then when you look at the finer details of the rules, it says the minimum font is 6 points. And I think, we can expect that many manufacturers are probably going to go with the minimum. And then if you put it next to a graphic like this, again, it's one of those things where it sounds great on paper, but how many people are going to actually see that text? So again, just to kind of a watch out where, you want to look at as much as you can, sort of all the details, because again, something can look really good on paper, but the actual implementation of it might not be as good as it sounds. So then really, like I said, almost immediately after legalization passes, you go into the next stage, which is implementation changes. So that is really already, more often than not, that's lawmakers proposing changes to the legalization law that they just enacted. And so, like I said, those can be almost immediately introduced. That's what happened in Maine. Is the next legislative session after the citizens of Maine passed a legalization, there were already bills to change aspects that were just voted on. The other piece of this is, as with other industries, with commercialization, there's going to come a lobbying effort. So state level and federal level, there's a lot of lobbying organizations around this. And certainly, as with other industries like tobacco and alcohol, certainly one of the things that they're looking at and representing their industries is, changes that are going to make them more profitable. But as we know from the examples of tobacco and alcohol, those often run counter to our goals to protect public health and public safety. So just some examples of what we saw around medical marijuana in terms of some changes that were proposed. So most states that have medical marijuana have a list of conditions. So you have to have a condition on the list to be able to get access to medical marijuana. So actually in the state of Maine, through our legislature, they actually eliminated that list. So right now in Maine, you don't actually have to have a specific condition. You just have to have a doctor sign off on a piece of paper that says your condition can be treated by medical marijuana. We also had patient caps for our medical marijuana caregivers. And we also had a statewide cap on the number of dispensaries there could be. And so these are all changes that went through the legislature in the last session. When we look at our adult use marijuana law, we've seen the same thing as where implementation has just started. There's already changes that have been proposed. So in our implementation legislation, we had a buffer zone, required buffer zone between schools and any licensed marijuana, adult use marijuana, whether it was a dispensary or a cultivation site. There was a required buffer zone of 1,000 feet between those licensed operations and schools. Already we had a bill that's been introduced to reduce that to 300 feet. And the argument with that is that's what our buffer zone is for alcohol outlets in Maine. So they want to make it equivalent to Alcohol, of course, those of us in the public health community are saying, well, let's do it the other way around. Let's increase the alcohol buffer zone to 1,000 feet. Also in Maine's adult use marijuana law, we had a specific prohibition on delivery sales, but we've had a bill introduced that's being debated currently about allowing delivery sales. So, so again, like legalization isn't the end of the story. Almost immediately, you'll see changes start coming through your legislature. So it's really critical. There's one message I get. There's only one message I get across. This is one of them. This is it. Is that it is very critical for those of us in the prevention field to be aware of what's being proposed and voted on in our states and our communities. So that includes the legalization initiatives, whether it's going through your legislature or if it's something that the citizens are going to vote on. If it's passed, what that implementation law is going to look like. If that gets passed by the legislature, what the proposed rules and regulations are going to be, and then really staying on top of the ongoing proposed changes. Because this is, I mean, I can just tell you from personal experience, it's rapidly changing. It's always evolving. There's always new things being put forward. So it's really important for us to be on top of this so we can anticipate how it's going to affect what we do and our roles in our states and our communities. And one pro tip I have on this is if you don't have within your coalition or within your, in your partnerships, legal expertise, if you have the ability to kind of get that, whether it's through a coalition member or other networking, if you can get that kind of expertise to help you out looking at these things, that would be very important. Because I will tell you that loophole I showed you, none of us saw that until we had someone in our coalition that had some legal background pointed out to us. And just, along with this, what you want to be looking for are those things that really, you want to look at it all, but in particular, we want to focus on those areas that affect what we focus on in prevention. So, the risk factors that we look at. And so examples of that are what is being proposed around advertising, what's being proposed around labeling, packaging, buffer zones, possession limits, age limits, plant limits, local control options, license types. So there's a lot of aspects of this it's important for us to be aware of what's being proposed, and then if it passes, what that's going to look like. So let's show you talk about a couple of examples from some other states as examples of how policies can impact what we're concerned about in public health. So one example is the state of Oregon. And you may be familiar with this where it's nearby, but one thing that Oregon has been experiencing is this glut or surplus of harvested marijuana in their state. So this report from a couple months ago that Oregon had a pot surplus of more than 1 billion joints. And this is sort of the graph that kind of is a trajectory of the amount of harvested marijuana products per capita. It charts it out as years of THC supply. So you can see at January 2019, there was basically a 6.5 year supply of THC harvested on a per capita basis. So there's basically an overproduction of THC supply in the state of Oregon. And for us in prevention, why would we be concerned about that? Because it has a big effect on the price. And as we know from the research and the examples of tobacco and alcohol, we know that price has an effect on youth use and adult misuse. So in 3 years, the price of marijuana in Oregon went from $10 a gram to less than $5 a gram. And again, we can look at the alcohol research and see why that's something we would be concerned about and how that can have an effect on some of the risk factors that we pay attention to. So there are some states are reacting to this to try to put some things in the policy that can help mitigate or prevent these issues. So this is an example in Maine, but I think other states are adopting this as well, which is in many states, they have different tiers for the cultivators, which basically each tier is like the maximum amount of square footage you can have to grow marijuana. And so this example has 4 different tiers. And so there's this bolded provision here, which is that if a cultivator starts at tier 2 and they want to move up to tier 3, before they can do that, they have to demonstrate to the state that they have sold at least 85% of their product. So this is to try to kind of prevent, again, some of that overproduction. That you're not going to be able to produce more until you can demonstrate that you're selling at least 85% of what you're producing. Another policy example is in, again, Colorado, again, one of the first states. And one of the things that they experienced in the early stages were issues around the edibles. In the early days, there were a lot of these edible products that had multiple adult doses of marijuana or THC in one product, such as these segmented chocolate bars and other candy products. And so, and I think many of you are probably familiar with this, one of the issues they saw is when people were consuming, they were consuming too much of it, because when they consumed one dose, or what was intended to be one dose, because of the delayed effect, nothing was happening. And then you see people eat a lot of it all at once. And then when it hits the system, people get really sick. Of course, the other issue with the edibles is that when they're out of the packaging, they're indistinguishable from other products. And so some of the things we saw in the data were this rapid increase in the amount of exposures to young children and adolescents. So some of the things through policy that states have looked at is trying to put some more stricter regulations around packaging, so that individual doses are individually wrapped, that packaging is child resistant and tamper evident. But other pieces around packaging and labeling is addressing things like cartoon characters, the shapes of the products, things like that to attempt to reduce the appeal to young people. And then, some states are requiring health warnings or not allowing them to make health claims. But again, as I showed you earlier, it can look good on paper to say you have to have a health warning, but the implementation of that's going to be really important, because if you have a minimum 6-point font, people might not see that. So I've focused a lot on state policy, but there's really other layers of policy that we want to take a look at. And so obviously there's also the federal level of policy where not a lot has changed. I mean, there's different banking initiatives that have come before Congress, but nothing yet in terms of national legalization of marijuana. Although I think we can expect to see those proposals continue to come. But two other important layers are the municipal local layer, and then also organizational layer of policy. So talk a little bit about municipal policy. One thing, particularly with adult use marijuana, but also with medical marijuana legalization, is that one of the decisions that states have to make is what the structure of local control is going to be. Most states that have adult use marijuana, for example, are what we call opt-out states. So what that means is, at a local level, when it comes to whether or not they allow retail sales or to what extent they allow retail sales, they have to have a local vote to opt out of either a certain license type or all license types. So if a particular municipality does not want to just be a quote-unquote dry town, they don't want to allow any retail sales, they're going to have some kind of local ordinance or a town-wide, citywide vote or town council vote or something like that says this municipality is going to opt out of allowing retail sales within our community. Maine is actually one of the rare opt-in states where we kind of did the opposite, which is by default, in this opt-in structure, by default, all of our towns and cities were dry towns after legalization passed. And then so a local town or municipality or city basically has to have a local vote to opt into allowing sales. So it's the inverse of opting out. It'll be interesting to see, if any research is done on this in terms of the effects of this on public health. Is one more beneficial to public health versus the other, opt-in or opt-out? So that's a big decision that municipalities have to make after, if and when legalization passes, is whether or not they're going to opt out or opt in, depending on what the state allows. If a municipality does opt in or if they don't opt out, other things they have to consider are zoning. So if they're going to allow retail sales, where within their municipality are they going to allow those? Is it only going to be commercial zones? Is it going to be industrial zones? Is it going to be allowed in residential zones? Those kind of things. Local rules and guidelines. So, the states are certainly going to set some standards to be licensed, but does the municipality want to put some other rules and regulations on top of that at the local level? Local enforcement is going to be a big thing for municipalities to look at. Frankly, they need to look at what's it going to cost for them to do that, and to help inform some of these other decisions about whether they allow retail sales and whatnot, because there's going to be more enforcement that's involved, and that's going to require resources. But also just thinking about, how is enforcement going to be done? Is it going to be by a code enforcement officer? Is it going to be by a regular law enforcement? Like, what's that going to look like? Buffer zones around schools, like, are they going to go with the state standard, or are they going to enact a stricter standard? Smell and nuisance ordinances. I can tell you from personal experience, after legalization, you definitely, that's something you can encounter. Often when I leave my house to go to work in the morning, I smell it in my backyard, and that's a tricky thing to deal with. I'm not sure if any municipalities quite figured this out yet, but it's certainly something municipalities are going to hear about. But then there's other aspects too. Parcel limits for home grows. So the state says each adult can have 6 mature plants. At the local level, do they want to put a cap on that and say, if you have 4 adults, you're not going to have 24 plants. We're going to cap you at 12 plants. And then local licensing fees, which it can tie into some of these other decisions. If you're going to need to hire more officers to enforce rules and regulations, then you might want to consider, does that affect what you want to charge for a local licensing fee, so you can afford that. So there's a lot to think about at the municipal level. Likewise, organizations in states that pass medical or adult use legalization also have a lot to think about. And this is just an example of some of the organizations that have to think about what they may or may want to do around policies. Housing is one. What's going to be allowed? If you have residents that have medical marijuana cards, or are going to want medical marijuana cards, are you going to allow them to consume? Are you going to allow them to do that on their property? Or if you're not, how are you going to communicate that? Education, and that's both K through 12 and colleges and universities. K through 12, obviously, states that are legalizing, they're setting age limits of 21 and over. But sporting events, and there's other events where adults are going to be present. So that's an example of something schools have to think about. Are they going to allow, is someone going to be allowed to have something on them while they're on premise? Colleges and universities, are they? Most colleges and universities in legalized states, they don't. They have a prohibition on, no matter what your age is, possession can't happen on campus because, for many reasons. A big one is most colleges have some kind of federal funding that they don't want to jeopardize. But the trick with that is communication. You have out-of-state students who are not paying attention to the finer details of what's allowed and not allowed. And if you don't have a good communication strategy, students may not know or understand that even though they're 22, they can't have marijuana in the dorms. Employers, what are they going to allow? What are their, how are they going to handle employees who may be using before they come to work? How are they going to handle that? Healthcare. This is something that came up in Maine. There was a proposal to allow people with medical marijuana cards to be able to possess marijuana in hospitals. So this is an example of things that healthcare settings might have to look at. Transportation, whether we're talking about school buses, public buses, trucking, those kind of things. And I'm sure you can think of a lot of other examples. But the bottom line is, if a state does pass legalization, it's municipal level needs to think about this, but also organizations need to think about looking at their policies, and is there something they need to add or amend to protect themselves, to protect their clients, their employees, and whatnot. And, frankly, this is where we in prevention can come into play as supporters, because if there's going to be policy changes, as we know, some best practices. You need to do some training on those new policies. You need to make sure you have effective communication strategies. Another best practice is going to be monitor and evaluate the implementation of new policies, and then a strategy for periodic review and revision of policies. So, in prevention, we do a lot of that work with schools and other institutions when it comes to policy. So this really is definitely in our wheelhouse, and I think something that we can play a large role in. Anyways, taking a look at our time. So next, I want to talk a little bit about. We've talked about the life cycle of policy change and what that means, what the stages are, and the different layers. But so then how are we going to approach this in prevention? How are we going to approach how we do prevention in the era of commercial marijuana? And I think, we already have some tools that we can use. We have the strategic prevention framework. We can use that process to figure out how we want to address this. And we have the 7 strategies. And so these are tools that we already have that we can use to help guide how we're going to navigate marijuana prevention in an era of commercialized marijuana. So, one of the things that we look at when we're doing our needs assessment is looking at some of the intervening variables. So those group of factors that we know in the research that contribute to substance use. And, when it comes to commercial marijuana, they're really not that different from commercial tobacco or alcohol. They're very similar. So we're talking about things like perceptions of risk and harm, retail access, social access, pricing and promotion, policies and enforcement, and norms favorable to youth substance use. So we've already been dealing with these when it comes to prevention in alcohol and tobacco. So with commercial marijuana, a lot of these are going to be similar. These are going to be similar intervening variables that we're going to have to look at to address. Of course, and then the other thing that when we're doing our needs assessment and we're identifying what some of these variables might be in our particular community, in our state, we need to look at the contributing factors. So for a given intervening variable, what does that look like in our community? How are we going to see that? What is the data showing us that we know that this particular intervening variable is something we need to address? And there can be 1 or 2 or 3. I mean, it's whatever the data shows us that to show that we know that this is a intervening variable we need to address. And of course, it's going to be really important to have that data to back that up. So let's look at an example of what this could look like. So let's say through our needs assessment, we know from either the legalization law that's passed or some of the data that retail access to marijuana in the community is going to be an issue. How do we know that? Maybe one of the contributing factors we're seeing is that a nearby dispensary is open and they're not carding their customers consistently. So they're not checking IDs on a regular basis. And so there are minors under 21 who are able to get in and purchase marijuana products. Maybe another contributing factor is the location. We know that the particular dispensary is located within 500 feet of a school. Another contributing factor might be that we know from data that there's a large number of adults that are buying products for minors, similar to what we've seen with alcohol and tobacco. So let's say that those are some examples. So we can then use our 7 strategies to think about, okay, so how are we going to address this? So if you're not familiar with the 7 strategies for community change, I'm going to provide a link here. I think many of you are probably very familiar with these, but these strategies are providing information, enhancing skills, providing support, reducing access and enhancing barriers, changing consequences either through incentives or disincentives, changing physical design, or modifying and changing policies. So I'm going to use our example here to walk through some examples of what some of these strategies might look like. And so when I learned these 7 strategies, one of the tricks I was taught was to actually start with your policy and then you link the other strategies with that. So let's say in this example of, the retail access issue, there's a municipal policy that's being proposed that would require training for dispensary staff on carding, consistent carding and other strategies to prevent youth access. So we'll say that that's the policy strategy that's being put forward. So now we have the opportunity to kind of link the other 6 strategies to this particular strategy. So when it comes to providing information, maybe what we want to do, one of the things we want to do is set up a town hall to talk about the effects of marijuana on youth, including the importance of preventing retail access. So through this, we can kind of put in front of the community the science of why retail access is an issue and why this policy change is important. In enhancing skills, that would be developing and implementing a responsible service training for dispensary staff. I'm not aware of something that actually exists at this point, but that's something that we could, maybe there's a researcher or someone that would have the expertise to develop that. In terms of providing support, maybe a municipality or state wants to set up a tip line where there's an ability to anonymously report when that there's an issue with a dispensary not carding properly and underage sales. Enhancing access and reducing barriers. Something around there could be supporting the acquisition or the adoption of technology that would allow for more consistent detection of fake IDs. Changing consequences. So a couple of examples is as a disincentive would be fines for dispensary owners that are found to be selling to the minors, but as an incentive, but then the flip of that is maybe there's some kind of incentive for owners and clerks that are 100% in compliance with not selling to minors. Changing physical design, maybe there's something about the particular design of the dispensary that lends itself to minors being able to get in. So maybe there's a design change that could help address that. So these are just some examples of how using the 7 strategies you can address a particular intervening variable that you identify. So, to kind of get to the end here and wrap up, so I've talked a little bit about some of the challenges and risks that can come up through policies that are put forward, whether we're talking about medical marijuana legalization or adult use legalization. But there's also opportunities for policies to help protect public health. And there's just some examples. So on the state level, there's some things states can look at that might help prevent and mitigate youth access and addiction and the issues that we care about. One is to require the collection and monitoring of public health data. A lot of states by default put a lot of focus on looking at the economics, the tax revenues and that kind of data. But states could take the lead in requiring the collection and reporting of public health data. So we have kind of both sides of how this is impacting states. Requiring strict standards and regulations for packaging, labeling, and advertising, and really looking at all the details, like is 6-point font going to do it for health warnings? Requiring training for dispensaries, using revenues to fund prevention and education, and then looking at those buffer zones between retail marijuana licensed locations and schools, and frankly, not stopping at schools, thinking about daycares, private schools, other kind of institutions or organizations that are youth-serving organizations and locations. At the municipal level, and I kind of already touched upon some of these, requiring as a condition of municipal licensing some kind of training for staff in terms of ID checks and other things to prevent youth access. Thoughtful zoning to prevent storefronts in family-friendly areas. And frankly, to go along with that, we also maybe want to get ahead of thinking about outlet density and those kind of issues. Looking at restrictions on signage and advertising in storefronts and newspapers and those kind of things. Looking at strong policies for public and municipal recreation areas and other public spaces. Requirements and standards for securing and obscuring home grows. So people are allowed to grow at home. Are there requirements for them to have fences and security system to prevent their location from being a target for robberies and other issues. So I think we're pretty much at the end of this. I did want to share, I know we'll go to some questions, but some resources as you're looking at your prevention approach. The PTTC network has developed a marijuana prevention education toolkit that's on our website. And when you get the slides, all these links are live, so you'll be able to get to all these resources. SAMHSA has recently come out with an evidence-based resource guide that focuses on marijuana and pregnancy. And then there's also these other two resources that are some inventory of programs that have found to have some effect on youth marijuana prevention. So I highly encourage you to check those out. So with that, there's my contact information. If you have any follow-up questions after this, certainly don't hesitate to reach out. And then also if you're active on Twitter, you can follow me on Twitter there. But with that, I think I'll turn it over to PTTC.
Thank you so much, Scott. That was so helpful, and I think it will be very helpful to our region that is experiencing a lot of what you are talking about right now. So thank you again.